7 million American children have been diagnosed with ADHD. 3.7 million of them take medication. The most common one causes appetite loss in 74% of cases, insomnia in 47%, and irritability in 57%. In 2019, researchers gave 54 children a different option, a spice, 20 to 30 milligrams a day. After 6 weeks, no significant difference from the drug, no appetite loss, no insomnia. The trial was never mentioned on television. The spice is saffron, Crocus sativus, the dried stigma of a purple flower that blooms for exactly 2 weeks per year. Each flower produces only 3 threads. It takes 150 flowers, picked by hand, to produce a single gram. Iran grows 90% of the global supply. The rest comes from Kashmir, Spain, Greece, and Morocco. It has been cultivated for 3,500 years. It is the most expensive spice on earth by weight. It retails between $5 and $15 per gram. It has been called red gold for longer than anyone can remember. But saffron was not always sitting in a jar on a kitchen shelf. 3,000 years ago, Persian physicians prescribed it for melancholy. Egyptian pharaohs used it in perfumes and embalming rituals. Cleopatra reportedly bathed in saffron-infused mare's milk before meeting a suitor. In 334 BC, Alexander the Great's generals packed his open battle wounds with saffron to speed healing. Hippocrates prescribed it for coughs, colds, stomach ailments, uterine bleeding, and insomnia. Homer mentioned it in the Iliad. Buddhist monks chose it as the color of their robes. For 35 centuries, the ancient world treated this flower as medicine. Then something happened. In the 14th century, the Black Death swept across Europe. Demand for saffron exploded. The sick wanted it. The dying begged for it. In 1374, an 800-pound shipment of saffron, valued at over $500,000 by today's prices, was hijacked on its way to Basel, Switzerland. The theft triggered what historians call the Saffron War. It lasted 14 weeks. Noblemen fought over a spice because it was the closest thing to medicine they had, and they were not entirely wrong. Fast forward 600 years. In 2004, a research team at Tehran University of Medical Sciences, led by Shaheen Akhondzadeh, published a landmark trial. They gave patients with mild to moderate depression 30 milligrams of saffron per day for 6 weeks. The control group received a placebo. The result was published in BMC Complementary Medicine. Saffron significantly outperformed placebo. That was not the remarkable part. In 2005, the same team ran a head-to-head trial. Saffron versus fluoxetine. Fluoxetine is the generic name for Prozac, one of the most prescribed antidepressants in the world. After 6 weeks, there was no statistically significant difference between the two groups. Saffron matched Prozac. The study was published in the Journal of Ethnopharmacology and has been cited hundreds of times since. The pharmaceutical industry did not issue a statement, but Akhondzadeh's team was not finished. In 2019, they published a new trial. This time, the target was not depression. It was ADHD. The study was a randomized, double-blind pilot trial involving 54 children diagnosed with attention deficit hyperactivity disorder. One group received methylphenidate. Methylphenidate is the active ingredient in Ritalin, the most commonly prescribed ADHD medication in the world. The other group received saffron extract. 20 milligrams per day for children under 30 kilograms, 30 milligrams per day for those above. The trial lasted 6 weeks. The results were published in the Journal of Child and Adolescent Psychopharmacology, one of the most respected pediatric psychiatry journals in existence. The conclusion read, and these are their words, that saffron demonstrated satisfactory outcomes in the treatment of ADHD. There was no statistically significant difference between the saffron group and the methylphenidate group. The children on saffron improved at the same rate as the children on Ritalin. Read that again. A spice matched the most prescribed ADHD drug in a peer-reviewed, randomized, double-blind clinical trial. And it did not stop there. In 2022, a second trial was published in the journal Nutrients by MDPI. This study used a proprietary saffron extract called Saffron Active and found comparable efficacy to methylphenidate, particularly for hyperactivity symptoms. A third trial, published in the Iranian Journal of Psychiatry and Behavioral Sciences, tested saffron in combination with methylphenidate and found that the combination outperformed methylphenidate alone. 3 trials, 3 confirmations, all peer-reviewed, all available on PubMed right now. Not one of them made national headlines. Now consider what those children were being compared against. Methylphenidate is a Scheduled controlled substance in the United States. It works by blocking the reuptake of dopamine and norepinephrine in the prefrontal cortex, which increases the availability of these neurotransmitters and improves attention. It is effective. Nobody disputes that. But a 2014 study published in the Iranian Journal of Psychiatry found that 74.3% of children on methylphenidate experienced anorexia, meaning significant appetite suppression. 47.2% experienced insomnia. 57.1% experienced irritability. Additional side effects included headaches, stomach aches, and slowed growth. The Child Mind Institute lists appetite loss, sleep problems, mood swings, and rebound irritability as the most common concerns reported by parents. The NHS in the United Kingdom lists decreased appetite, trouble sleeping, headaches, and stomach aches as standard side effects in more than 1 in 100 children. Saffron, in all 3 ADHD trials, reported no appetite loss and no insomnia. The Children's Hospital of Philadelphia, in a December 2025 review, stated that Saffron improved symptoms of hyperactivity and benefited sleep in patients with ADHD without serious safety concerns. That sentence alone should have been enough to make the front page of every parenting website in America. It was not. Now let us talk about what saffron actually does inside the brain. Crocin and saffronol are the 2 primary bioactive compounds in saffron. According to a review published in PMC, crocin inhibits the reuptake of dopamine and serotonin. Saffronol inhibits the reuptake of dopamine and norepinephrine. That is, functionally, the same mechanism of action as both Ritalin and Prozac combined. A 2013 animal study published in the Journal of Behavioral and Brain Science found that saffron aqueous extract increased brain dopamine and glutamate concentrations in a dose-dependent manner. A 2026 preprint from BioRx-IV confirmed that saffron's antidepressant effect operates through modulation of dopamine and serotonin transport proteins. The science is not mysterious. The chemistry is published. The pathways are documented. This is not folklore. This is pharmacology. And yet, the ADHD drug industry alone is worth $14.96 billion in 2025, projected to reach $23.89 billion by 2035, according to SNS Insider. The broader ADHD therapeutics market, including diagnostic services and behavioral programs, reaches even higher. A single month of Ritalin costs between $60 and $350 depending on insurance and formulation. Without insurance, brand name Ritalin LA runs $150 to $350 per month. A 30 milligram saffron supplement capsule costs less than $1 a day. You can buy a 60 capsule bottle on Amazon or iHerb for between $12 and $25. That is 2 months of supply for the price of 1 copay on a Ritalin prescription. But you were never told this, and you have to ask yourself why. Approximately 1 in 9 American children has received an ADHD diagnosis. That is 11.4% of all children aged 3 to 17, according to the CDC using 2022 data. The number increased by 1 million between 2016 and 2022 alone. NPR reported it. Nature published a feature on it. In January 2026, ADHD diagnoses in boys doubled over recent decades. In girls, they quadrupled. In adult men, they increased 20-fold. In women, 15-fold. A Wall Street Journal investigation in November 2025 found that over 23% of ADHD-diagnosed children were on at least 2 psychiatric medications simultaneously by 2023. Nobody is saying saffron cures ADHD. Nobody is saying you should replace your child's medication without consulting a physician. That is not the argument. The argument is that 3 randomized controlled trials exist. The data is there, the mechanism is understood, the side effect profile is superior, the cost is a fraction. And you were never told. Because saffron cannot be patented. It is a flower. It grows in the ground. No pharmaceutical company can own it. You cannot create a branded, patent-protected version of a 3,500-year-old Crocus stigma. The global saffron market is worth roughly $1 billion. The ADHD drug market is worth 15 times that amount. That is the arithmetic that determines which studies make the evening news and which ones stay buried in a journal behind a paywall. The Akanzada trial is available on PubMed right now. The Nutrients trial is open access. The combination trial is indexed. The Children's Hospital of Philadelphia posted a public review. The mechanism of action papers are freely accessible on PMC. Everything in this video can be verified by anyone with an internet connection in 20 minutes. But verification requires someone to tell you the trial exists in the first place. In 2010, Akanzada published yet another trial, Saffron versus donepezil. Donepezil is the standard drug for Alzheimer's disease. After 22 weeks, Saffron performed comparably. A 16-week placebo-controlled trial the same year showed Saffron significantly improved cognitive function on validated Alzheimer's assessment scales. A 2025 systematic review published in the Egyptian Journal of Neurology confirmed comparable efficacy to both donepezil and memantine with a favorable side effect profile. The same flower: depression, ADHD, cognitive decline. 3 categories, 3 matches against pharmaceutical drugs, published, peer-reviewed, and ignored. 150 flowers, picked by hand, dried in the shade. 3 threads per bloom. That is what saffron is. That is what it costs to produce. That is why Iran, a single country, produces 90% of the global supply. That is why it costs $5 to $15 per gram. That is why an entire industry would prefer you never learn what it does. This video is not medical advice. This video is not telling you to stop any medication. This video is telling you that a peer-reviewed, double-blind, randomized clinical trial found no statistically significant difference between Saffron and Ritalin for children with ADHD, and that nobody told you about it. Every share, every comment pushes this further than any journal paywall ever could. The data exists. The silence was a choice.